Hello everyone, welcome to my channel. This video is about hypothermia or cold stress in newborns. Hypothermia is defined by the WHO as a core temperature of less than 36.5 degrees centigrade. Normal skin temperature in the neonate is 36 to 36.5 degrees centigrade and normal core, that is rectal temperature, is 36.5 to 37.5 degrees centigrade. Now, auxiliary temperature may be 0.5 to 1 degree centigrade lower. Now, chance of survival of the neonate is markedly enhanced by successful prevention of the excessive heat loss. For this purpose, a newborn must be kept under a neutral thermal environment. This is defined as environmental temperature at which heat production and oxygen consumption is minimal, yet core body temperature is maintained within normal range. Now, term newborn has brown fat as a source for thermogenesis. It is a highly vascularized tissue and is innervated by sympathetic neurons. When these infants face cold stress, noradrenaline level increases and act in the brown fat tissue to stimulate lipolysis, and this produces free fatty acids. Most of the free fatty acids are re-esterified or oxidized, and both these reactions produce heat. Now, hypoxia or beta-adrenergic blockade decreases this response. Now, the mechanism of heat loss in the newborns. First is radiation. It is a heat loss from the infant, that is the warm object, to a colder nearby object. Second is conduction. It is a direct heat loss from the infant to the surface with which he is in direct contact. Third is convection. A flow of cooler ambient air carries the heat away from the neonate. Then fourth is evaporation. Heat may be lost by water evaporation from the skin of the infant. This especially occurs immediately after delivery when the infant is wet with amniotic fluid. Now, the etiology of hypothermia in neonates. It may be caused by environmental factors, disorders that impair thermoregulation, for example, sepsis, intracranial hemorrhage, drug withdrawal, or combination of these. Now, the risk factor for hypothermia. First is the prematurity. Preterm infants are predisposed to heat loss because they have little subcutaneous fat, a high ratio of surface area to body weight, and reduced glycogen and brown fat stores. They have immature shivering and vasoconstriction mechanism in response to cold stress. They often require resuscitation, which require exposure for assessment, and this results in cold stress. Second is IUGR. They have relatively large surface area to body ratio and lack of subcutaneous fat. Third is birth asphyxia. These newborns have poor peripheral circulation and become hypothermic, especially if prolonged resuscitation is required. Then is the delivery in an area with an environmental temperature below the recommended levels. Maternal hypertension and cesarean delivery are also risk factors for hypothermia in newborns. Now, the signs and symptoms of hypothermia. Infant is cold to touch, has weak sucking and cry, and has less activity. There may be slow, irregular breathing, slow heart rate, that is bradycardia, cyanosis, sclerema, or generalized bleeding. Cyanosis is a blue discoloration of the skin due to circulation of blood low in oxygen. And sclerema is a condition in which body tissue hardens, especially those of the fatty layer just under the skin. Now, the complications of hypothermia in neonates. These include hypoglycemia, metabolic acidosis, hypoxia, clotting disorders such as DIC, disseminated intravascular coagulation, and pulmonary hemorrhage, shock, decreased perfusion, intraventricular hemorrhage, apnea, severe sinus bradycardia, and increased neonatal mortality. Now, the management of neonatal hypothermia. Prevention is the best management and remove the precipitating factors. For full terms, ensure a temperature of 25 to 28 degrees centigrade in the delivery room. Now, delivery and operating rooms where preterm infants are going to be delivered should have a temperature of 23 to 25 degrees centigrade. At the time of birth, babies should be immediately dried and then swaddled in a warm blanket. A preterm infant can be placed into a polyethylene bag immediately after delivery, and this helps to maintain the infant's temperature. Now, a neonate exposed for resuscitation or observation should be placed under a radiant warmer without anything blocking heat to the infant, such as a blanket. Sick neonates should be maintained in a neutral thermal environment to minimize the metabolic rate. The proper incubator temperature varies depending on the newborn's birth weight and postnatal age, and also the humidity in the incubator. Heating can also be adjusted with a servo mechanism set to maintain skin temperature at 36.5 degrees centigrade. Now, in hypothermic neonate, slow rewarming is indicated. Rewarm at a rate of 0.6 to 1 degree centigrade per hour. During rewarming, skin temperature should not be more than 1 degree centigrade warmer than the coexisting rectal temperature. Full-term infant can be rewarmed under a radiant warmer, but preterm may require an incubator. The newborn should be monitored and treated as needed for hypoglycemia, hypoxemia, and apnea. Underlying conditions such as sepsis, drug withdrawal, or intracranial hemorrhage may require specific treatment. Okay friends, thanks for watching. Please like, share, comment and subscribe to my YouTube channel for more informative health videos.